السلام عليكم. FGF 21 level and its relationship. FGF 21 level and its relationship to cardiac dysfunction in CKD patients. Since the discovery of the first fibroblast growth factor almost 40 years ago, the FGF family has expanded over the years and currently consists of 22 members with a wide range of biological functions, including cell growth, angiogenesis, wound healing, and metabolism. This figure shows the subfamily of GFF according to mechanism of action, paracrine, intracrine, and endocrine function. We note that FGF21 is belonging to FGF23 subfamily. FGF21 was first cloned identified from the mouse embryos by homology-based PCR in 2000. Human FGF21 is a polypeptide of 181 amino acids with 75% identity to the mouse. FGF21, it is secreted predominantly by the liver, but also by other tissues involved in glucose and lipid metabolism, such as adipose tissue, pancreas, and skeletal muscle. Renal excretion is a major route for FGF21 elimination. Serum FGF21 level has been shown to be increased in patients with impaired renal functions. Patients undergoing chronic hemodialysis have elevated serum FGF21 level more than 15-fold that of controls. Serum FGF21 concentration was associated with residual renal functions and insulin resistance in end-stage CKD patients on long-term hemodialysis. Patients with chronic kidney disease are at profoundly higher risk of cardiovascular morbidity and mortality. Multiple epidemiological studies have demonstrated that both reduced renal functions and proteinuria are significantly and independently associated with an increased risk of cardiovascular death. In multivariate adjusted analysis, patients with end-stage renal disease had 10 to 20-fold higher risk for cardiovascular mortality. Such increase in cardiovascular risk are not limited to patients with the most advanced renal disease on dialysis. Those with mild to moderate chronic kidney disease are also at significantly higher risk of cardiovascular disease, and patients with both overt proteinuria as well as microalbuminuria without reduction in estimated GFR are also at significantly higher risk. The mechanism underlying cardiovascular risk in CKD are multifactorial and begin early in the course of renal disease. Not only the traditional cardiovascular risk factors such as hypertension and diabetes highly prevalent in CKD population, but also non-traditional risk factors specific to CKD and end-stage renal disease patients are also highly prevalent and contribute to this risk. These include excessive stress, inflammation, endothelial dysfunction, anemia, extracellular volume of fluid, malnutrition, abnormal calcium and phosphorus metabolism, infection, uremic toxin, as well as sympathetic nervous system overactivity. Aim of the study aims to assess FGF21 level and its relationship to cardiac dysfunction in different stages of CKD patients. Methodology. Patients were classified according to estimated GFR. First group are healthy control subject, and according to GFR classified to group 2, 3, 4, 5 from stage 2 to end-stage renal disease on regular hemodialysis 3 times per week. Exclusion criteria include overweight and obesity, uncontrolled hypertension, uncontrolled diabetes, cardiac valve disease, ischemic cardiomyopathy, and cirrhotic liver. All patients were subjected to full history, detailed clinical examination, stressing and blood pressure, body mass index, possibility of insulin resistance according to HOMA-IR. Laboratory tests include kidney function, lipid profile, fasting insulin, and fibroblast growth factor intact BTH. Echocardiography. All subjects underwent two-dimensional transthoracic echocardiogram and tissue Doppler imaging to measure left ventricular thickness, left ventricular mass index, and left ventricular function. Systolic by ejection fraction and fraction shortening, and diastolic by early peak and delayed transmitral flow velocity. And tissue Doppler imaging done to measure what's called E' that remain to early peak diastolic annular velocity. And E over E' ratio are calculated to assess diastolic function more accurately. As we show in this table, FGF level increased with the progression from stage to another stage of CKD. Here in group 5, which in the stage renal disease on regular dialysis, patients are 20 to 12.6 fold higher as compared with group 1. As this figure shows progressive increase in FGF21 level with the duration of renal function. There was no significant difference between diabetics and hypertensive and other etiology of renal disease as regard FGF21 level. This short figure shows that left ventricular mass index increased with deterioration of renal function. The systolic function here by E over A ratio in group 5 is higher than other group, while in group 3 it is reversed. It's not normal, it is reversed. This means that there is increased left ventricular thickness resistance against atrial contraction. By tissue Doppler, E over A ratio increased with the duration of renal function. But what about the relation between FGF20 level and the parameter of echo as regards left ventricular mass index and systolic and diastolic function? This table shows that FGF21 has significant positive correlation with left ventricular mass index and diastolic dysfunction, while it has no significant correlation with systolic function guided by ejection fraction and fraction shortening. This shows also positive correlation between FGF and left ventricular mass index and diastolic dysfunction. Conclusion. It may be concluded that serum FGF21 level is increased from early to end stage renal disease, and its increase is associated with deterioration of renal functions. FGF21 is associated with increased left ventricular mass index and diastolic dysfunction, but not associated with systolic dysfunction in CKD patients. Recommendation: FGF21 has multiple metabolic actions, so it can be used in management of dyslipidemia, obesity, and diabetes. FGF21 can be used to monitor the deterioration of kidney function in CKD patients. Assessment of the relation between FGF21 and the cardiac dysfunction need more studies on large number of patients to be more clarified. Thank you.